Hip pain can arise for a variety of reasons, most commonly caused by hip osteoarthritis. What is hip osteoarthritis? Osteoarthritis is of a chronic nature, most commonly characterized as a form of chronic arthritis. This can present with joint pain, swelling, stiffness, and reduced mobility. Symptoms. Depending on the condition that's causing your hip pain, you might feel the discomfort in your thigh, inside of the hip joint, groin, outside of the hip joint, or buttocks. The hip joint can withstand repeated motion and a fair amount of wear and tear. This ball and socket joint, the body's largest, fits together in a way that allows for fluid movement. Sometimes pain from other areas of the body, such as the back or groin from a hernia, can radiate to the hip. You might notice that your pain gets worse with activity, especially if it's caused by arthritis. Along with the pain, you might have reduced range of motion. Some people develop a limp from persistent hip pain. Risk factors. Risk factors include being overweight or obesity, joint injury, and increasing in age. At present, there is currently no cure for osteoarthritis, but there are many treatments and approaches to managing the long-term symptoms of the disease. Causes. Whenever you use the hip, for example by going for a run, a cushion of cartilage helps prevent friction as the hip moves in its socket. Despite its durability, the hip joint isn't indestructible. With age and use, the cartilage can wear down or become damaged. Muscles and tendons in the hip can get overused. Bones in the hip can break during a fall or other injury. Any of these conditions can lead to hip pain. These are some conditions that commonly cause hip pain. Arthritis, osteoarthritis, and rheumatoid arthritis are among the most common causes of hip pain, especially in older adults. Arthritis leads to inflammation of the hip joint and the breakdown of the cartilage that cushions your hip bones. The pain gradually gets worse. People with arthritis also have stiffness and have reduced range of motion in the hip. Hip fractures. With age, the bones can become weak. Weakened bones are more likely to break during a fall. Bursitis. Bursae are sacs of liquids found between tissues such as bone, muscles, and tendons. They ease the friction from these tissues rubbing together. When bursae gets inflamed, they can cause pain. Inflammation of bursae is usually due to repetitive activities that overwork or irritate the hip joint. Tendinitis. Tendons are the thick bands of tissues that attach bones to muscles. Tendinitis is inflammation or irritation of the tendons. It's usually caused by repetitive stress from overuse. Muscle or tendon strain. Repeated activities can put strain on the muscles, tendons, and ligaments that support the hips. When they become inflamed due to overuse, they can cause pain and prevent the hip from working normally. Hip labral tear. This is a rip in the ring of the cartilage called the labrum that follows the outside rim of the socket of your hip joint. Along with cushioning your hip joint, your labrum acts like a rubber seal or gasket to help hold the ball at the top of your tight bone securely within your hip joint. Athletes and people who perform repetitive twisting movements are at a higher risk of developing this problem. Cancers. Tumors that start in the bone or that spread to the bone can cause pain in the hips as well as in other bones of the body. Avascular necrosis, often called osteonecrosis. This condition happens when blood flow to the hip bone slows and the bone tissue dies. Although it can affect other bones, avascular necrosis most often happens in the hip. It can be caused by a hip fracture or dislocation or from the long-term use of high-dose steroids such as prednisone, among other causes. Subscribe, like, and turn the bell notification on for more content like this. Thanks for watching and see you in the next video.